Good morning. I'm Dr. Jeff Marksberry, Vice President of Science and Education with Alpha-Stim. We thought we'd run through a Facebook Live tutorial today on how to use the Alpha-Stim trodes, when and where, how to use them, the lifetime of the trodes, and kind of give an explanation. Right now we currently have a sale going on with Alpha-Stim electrodes. They're typically $24. We have them on sale for $15. That will last for a couple more weeks, so we encourage you to get online and purchase those as you need them. So we wanted to explain a couple different things about the trodes. Typically, when we talk about Alpha-Stim, we talk about CES, or cranial electrotherapy stimulation. That's FDA cleared for anxiety, insomnia, and depression. But we also treat pain. When we treat pain, we treat the body with the probes. You may be familiar with MET, or microcurrent electrical therapy, using the probes to treat different areas of the body. But we also have the Alpha-Stim electrodes. With the electrodes, these are self-adhesive. They stick to the skin, and we use these for a couple different reasons. One is for soreness and pain. So if someone's got chronic injury, they have soreness, swelling, pain, you can use these electrodes as opposed to the probes. The probes are very quick and you get quick pain relief, but with the trodes you can leave these on long term. You can see some reduction in swelling and pain. It's very easy to use, especially if it's an area you can't get to yourself to treat with the probes, for your hip, your back, things like that. We also have a lot of people that use this for neuropathic pain, especially peripheral neuropathy when we treat the feet, for diabetic neuropathy, things like that, fibromyalgia, we can use the trodes. So anywhere that you have pain, and we'll go through a couple of different areas and show you some examples with that, because we get a lot of questions about that in particular. So one of the things we want to do is talk about the treatment time also, and the level that we use with the electrodes. So treatment time, we recommend at least an hour when you use these. For sports medicine, we've talked to people that, if you have an injury or a sprained ankle, for example, if you're a runner and you have a sprained ankle, you can put the electrodes on there. You want to use it for at least an hour, but you're able to use it as long as you want to. We actually have people that will use this for several hours at a time, or even sleep in it, if that's a possibility, if you can handle the wires. But the longer you use it, the more relief you're going to get. It's also going to help more with swelling as you use that longer too. So the electrodes themselves have a long shelf life, so they last for a long time. The thing that will actually wear out is the stickiness or the tackiness of the electrodes. So typically we see about a 2-week lifespan with the electrodes before you'll have to replace those. It does benefit you to wet these after you use them, when you put them back for storage. If you wet them when you put them on, you'll get some tackiness and they'll stick again. And we've also heard that people will put these in their refrigerator, and that will keep them more hydrated so they stick longer also. But in general, around 2 weeks is your lifespan for these electrodes. Okay. So we're going to show a couple of different examples. We've got our volunteer Liz here is going to be our patient, so we're going to show how and where to use the electrodes. So we have our Alpha-Stim M and our 2 lead wires hooked up to our device. So with 2 lead wires, we're actually able to use all 4 electrodes at the same time. Okay? So we do have a lot of different wires. One of the things you're going to want to remember with the Alpha-Stim when you're using all 4 electrodes is that the electrodes that come from the same lead wire will be transmitting the current back and forth. And I'll show you an example of this as we treat. So our device for the current level, when we use the electrodes, will be on 6. Okay, 6 is the maximum level, 600 microamps. As you treat, if that becomes uncomfortable, if you start to feel the prickly sensation, you're just going to want to turn it down to a comfortable level. It doesn't have to be higher to get a better treatment. You can adjust that as needed. So if you're on a sensitive area, on your love handle, lumbar area, something like that, your neck, you can start to feel a little pulse easier. The skin's not as thick there as, let's say, your hand or the bottom of your foot. So you would turn the current down to a comfortable level. So with Liz here, with our example, we're going to show an example of a knee treatment. Anatomically, it's just a really easy way to grasp the concept of what we want to do. So I'm going to say Liz has right knee pain, so I'll have you hold our device for us. So we're going to come out from the same lead wire, and with this lead wire we're going to go above and then one below the knee. So what we want to do here is draw a line from trode to trode, and this is where our current's going to pass through. So we're just drawing an imaginary line through that knee. We go out a little distal from the knee. We're not going to be in right on top of it. We do want to incorporate some of the musculature around the knee also. Okay, so that's our first one. Our second lead wire, same thing. We're just going to do a large X around this area. Okay, so we've got 4 electrodes drawing an X of current right through the area that's involved. So with this, we would turn our device on. Always make sure we're on 0.5 hertz. With the electrodes, we would actually change the timer to a continual timer. With continual, it's going to start at 0 and it's going to count up continually until you turn this device off. So that could be an hour, it could be several hours, and obviously we want to adjust our current. We would turn it up until you start to feel a little prickly sensation, but we want to make sure you're comfortable. As you wear it long term, you will start to feel more. Your skin will become more sensitive. If that's the case, if it becomes more sensitive, then you just move the placement. Okay, we move the placement, that'll give you another hour before you feel it again. So you can actually move those around as you need to, but we still maintain our X through the joint. Okay, that's our first example. Let's show what we would do for our shoulder. I'll have you hold that, Liz, and I'll take these off. Have you stand up for me, please. So for shoulder, we did a large X for the knee. What we want to do for the shoulder is a little bit different, but we're going to go front to back. It's beeping here as I have my touching these. So we're going to go front to back. The other important thing is to go across the spine when possible. So we're going to go all the way across the spine here. Okay. So we went front to back on the affected shoulder, and then we went laterally from right to left through the spinal cord. So we're going to bring the central nervous system into this. Okay? So we have our local treatment and across the spine for the central nervous system. You can't do this wrong. If you only use 2 electrodes, I would still go front to back. People do that all the time. They still get good results doing that. But if you have 4 electrodes you can use, you want to use all at the same time, definitely going across the spine is the way to go. So we're actually drawing a T in that case. That's the same thing we would do for the hip. So we'd go front to back on the hip and laterally through the hips also. Okay. So one other thing we get a lot of questions about that I wanted to touch on. Turn this off so we're not beeping. Have you go ahead and sit down. Is peripheral neuropathy. So we get a lot of questions about diabetic neuropathy, how to treat that. It's almost always lower extremity. So I was going to show you what we recommend. We've heard a lot of good feedback about this, so this is what we do. If I can get untangled here. No, maybe not. So with peripheral neuropathy, and we're talking about lower extremities, what we recommend, Liz, if I can see the bottom of your foot here, we're just going to place that on the bottom of each foot. When we do that, you can sit, watch TV, go about your daily. If you put socks on, they'll stay on really well. But you would do this for at least an hour, but again, with peripheral neuropathy, they have really severe pain. They may want to wear it for several hours at a time, and that's completely safe to do. We recommend using it as long as you can. But keeping those on the bottom of your feet, the current's obviously going to travel from electrode to electrode, so now we're incorporating the entire lower extremity. The current's going to travel across the spine, sacral plexus, and then down the other side. So at least an hour. Turn the current up to 5, 6, whatever you can tolerate. If it becomes uncomfortable, turn it down again. Okay? So that's our lower extremity peripheral neuropathy example there. Okay? Have you stand up. I'm going to show you the placement again for, this would be for lower back pain. So if I'm not going to use electrodes, but same thing, we're going to do a large X. If someone has lumbar pain, we're going to go from the shoulder to the hip and shoulder to hip with the other set of lead wires. So we're still going to draw our X. If it's upper pain, upper back pain, will just go at a higher level on the side. Okay? So you just want your X to cross over where your pain is. If it's lumbar, we're going to go down lower. Okay? Thank you, Liz. So that's our tutorial on how to use the Alpha-Stim electrodes. Again, they're on sale for another 2 weeks, so we recommend getting online, purchasing those while you can at the reduced price. If you have any questions, you can always call in 1-800-4PAIN or email us. We're here to help you. Thanks for tuning in.